If we look at the conditions in somewhere like Sweden, Sweden has avoided a lot of secondary transmission in the household because many people in Sweden live in single-family households or very small families in larger houses, whereas in Sweden, one of the problems they face with the Somali immigrant community is the Somali community in Sweden live in multi-family situations and often in some disadvantaged situations. So they had a much higher incidence of disease, not because the virus was different in them, but because the social conditions in which those people live allow the virus to transmit in those family groups. We saw the same in northern Italy, the multi-generational nature of houses. Why were so many older people exposed so quickly to this virus? Because older people live with younger people. It's a wonderful thing. The Italians should be greatly praised for the way you see multiple generations living together. I think it's a fantastic thing. But in the case of COVID, it meant a lot of older people became exposed to the infection within the household environment. I mean, older people aren't out partying, older people aren't going to the nightclubs. You know, they're not getting the disease. Older people are getting the disease at home or within the healthcare facility that they're in. And people are bringing that infection to them. So I think we probably need to move away from these polemics, these arguments of between science. I sometimes think when scientists clash, people get confused. When politicians clash, people get confused. When scientists clash, people get confused. We have to weigh all of the evidence, and we have to give people the clearest possible principles of how to avoid infection. That's what people want to know. People don't want to be scientists. No, just tell me what to do and give me a good reason why that's a rational thing to do. So when we say wash your hands, maintain your physical distance, avoid crowded spaces, wear a mask in the situations where you can't maintain any physical distance, right? Simple rules. These rules, if you're sick, stay at home. If you're sick and home and you can't be isolated, please stay away from your other family members if you can. Be in another room. We understand that's not possible for everyone. So a very, very simple set of rules to guide your daily life, and everyone can be safe.
Thank you. There are follow-up questions to this already coming. So one is as well, is the virus becoming weaker as the time passes? And I'll read one. Do you think this is more contagious than previous viruses, for example, Spanish flu? Do you think it will last up to 2 years like previous pandemics, epidemics?
So the first question, sorry, say the first question again.
The first question is, does the virus become weaker through the time?
So that's a good question because I think we're getting better at dealing with this virus. So the virus that is circulating has been circulating the globe. We have 35 million reported cases so far. Almost all countries have been affected by this, and we're 10 months in. And we are in a completely different situation than we were in a few months ago. And the reason I'm saying this is because we're getting better at finding cases. So through active case finding, we're detecting cases earlier because we have better surveillance, we have better diagnostics, and that means individuals are either isolated quicker, they're put in clinical care quicker, and that leads me to the second point. If individuals are put in clinical care sooner, then they can receive the actual care that they need. Doctors are better equipped, trained, they have PPE, they have experience with dealing with COVID patients. We know that access to oxygen, checking oxygen saturation when somebody comes into a medical facility, providing oxygen, providing dexamethasone when someone is severe or critical, that saves lives. And so our mortality rates are reducing, but that's not because the virus changed, it's because we're getting better. And that to me is an incredible sign of hope, that we have tools right now to actually, help people. The other thing is that we are preventing infections in these vulnerable populations. As Mike has talked about when we were talking about the transmission, in addition to what we were explaining about how it spreads, another factor in this is what we call the dispersion factor. It's a big fancy word that basically means not everybody transmits to somebody else. We are working with partners and estimate that between 10 and 20% of cases are responsible for about 80% of transmission events, which is why when we say that this operates in clusters and that it's the setting that is so important, if we allow this virus to spread in a setting that's an enclosed space and a long-term living facility, a prison, nightclubs, we, in a way, facilitate it. We give it the opportunity to spread between people who are singing or shouting or having long periods of time together. And so I think that's really important because, again, knowing that helps us do better at preventing it from happening. If we could prevent the virus from entering a long-term facility, and many countries are doing that because, unfortunately, in the beginning of this pandemic, some countries were really devastated by how many older people were dying in long-term living facilities. That is changing. We still need to work very, very hard to protect older people in that sense. But we are getting better at dealing with this virus, preventing amplification events, these super spreading events, caring for individuals, making sure that they receive the care that they need. And so I think that's why people may think that the virus is getting weaker, but make no mistake, this is a dangerous virus. There are more than 1 million people who have lost their lives, and the virus has a lot of room to spread. We know that the majority of the world remains susceptible to infection, and if we allow it to, it's in our hands. If we allow it to, it will spread. And many people, although luckily those many that get infected will recover, which is good news, there are people who will continue to die, and so we need to do everything that we can to prevent that.